Hello, you're tuned into daily COVID-19 updates. This is The Wire and today is the 14th of April. 10,363 people in India have been infected by the novel coronavirus so far. 1,036 people have recovered and 339 have died. In the last 24 hours, over 1,200 people contracted the virus and 31 people died. According to the Ministry of Health, of the 10,000 people who have been infected, 1,709 were cured within a single day. Maharashtra continues to report the highest number of confirmed cases in the country, followed by Delhi and Tamil Nadu. 6 more people contracted the virus in Mumbai's Dharavi today, taking the total number of people infected by the disease in Mumbai's slum pocket to 55. Meanwhile, the death toll in United States, New York, topped 10,000. Globally, over 19 lakh people have been infected so far, and over 1,18,000 people have died. The Indian Prime Minister today announced a nationwide lockdown extension. 1.3 billion Indians will now be under lockdown till the 3rd of May. Following the announcement in the morning, a huge crowd of migrant workers gathered at the Bandra station in Mumbai. Mumbai is a city with one of the highest population densities in the country and the capital of the state which has recorded the highest number of coronavirus cases in India. These are shocking visuals from Bandra on the first day of the second phase of India's lockdown. These migrant workers are reportedly from Bihar and Bengal. Most of them earn daily wages and live on rents. As the lockdown gets extended and with no source of income, they hope to go back to their villages. This is a developing story. To read more about this, you can log on to thewire.in. Medics in Mumbai continue to test positive as Maharashtra becomes the worst affected state by the pandemic. A technician from a Bombay-based hospital, 11 nurses from Bhatia Hospital, and 4 nurses and 2 doctors from a Dadar-based hospital were reported with the infection today. 4 hospitals and 2 nursing homes in Kolkata and Howrah are also either partially or completely shut after patients and doctors tested positive. More than 300 people who frequented the hospital and the nursing homes have been quarantined. Earlier on the 6th of April, 2 private hospitals in Mumbai were also sealed after some of their medical staff was tested positive. The number of people tested positive for coronavirus in Jaipur have more than doubled. On the 9th of April, 168 people were tested positive in the city, and today the number has risen to 370. The state health minister has said that the lack of public participation in following stay-at-home orders is one of the reasons for this spread. The administration plans to implement the Bhilwara model in Jaipur, which is characterized by aggressive testing, strict lockdowns, and large contact tracing. The ICMR, in its order today, said that it is possible for COVID-19 positive pregnant women to pass on the virus to their child. The ICMR laid down norms for both the care of the mother and the child. The guidelines also call for the use of personal protective equipment for hospital staff at the time of delivery. On the 4th of April, a healthy baby was born to a COVID-19 positive mother at New Delhi's AIIMS. The doctors at the time let the mother breastfeed the baby according to WHO guidelines, which say that the virus cannot be transmitted via breastfeeding. Maharashtra and Rajasthan, 2 states with high number of COVID-19 positive cases, have recommended HCQ or hydroxychloroquine to its police force as a preventive measure against coronavirus. Earlier, the drug was being taken by paramedics as a prophylactic drug. The drug is still unproven, which means that no clinical trial of the drug have happened so far. However, early stage results of research done in petri dishes shows that HCQ may be used as a prophylactic. To learn more about hydroxychloroquine and the coronavirus, you can watch an earlier episode of the Updates Bulletin linked in the description below. The Arogya Setu app, which was launched by the centre earlier this month, has clocked over 1.5 crore downloads within 2 weeks. According to government officials, the app might soon be converted into an e-pass for movement of citizens during the lockdown. Officials say that the function of the app can approve the movement of people who are clear of any threat of contracting or spreading COVID-19 disease. However, cybersecurity experts say that the efficacy of the app will depend on certain factors. A Chennai-based expert told the Indian Express that for the app to track interactions, COVID-19 positive people need to download it first. A large cluster can only be formed for intermobile communication if a large number of people are tested and all of them must have a smartphone too. US President Donald Trump has claimed total power to lift the nationwide coronavirus lockdown if he wishes. In a press conference, Donald Trump said that the President of the United States calls the shots. The United States has become the global epicenter of the coronavirus pandemic with 6 lakh confirmed cases and 23,000 deaths. Meanwhile, according to a BBC report, 10 states on the US's east and west coast are planning to lift their stay-at-home orders. The Trump administration has signaled the 1st of May as potential date for easing restrictions. The current White House recommendations for Americans to avoid restaurants, non-essential travel, and keep in-person gatherings to no more than 10 people will expire on the 30th of April. However, governors have asserted that it is their prerogative when the coronavirus-related restrictions will get lifted. Yesterday, the United States top immunologist Dr. Anthony Fauci told CNN that the nation could have saved more lives if restrictions were announced sooner. That's all for today. Thank you for tuning in. Keep reading and watching The Wire. We will see you tomorrow. Until then, stay safe.